Cool.
That's not the first page. That's the first page. Okay. I'm gonna knock. Hi, my name is Trista. I'm gonna be your student nurse today. I'm gonna go wash my hands real quick and I'll be right back.
Okay.
Wash my hands. I'm gonna come back. Okay, if you could just tell me your name and your date of birth.
Kaylee Duffy, 210 of 03.
210 of 03. Okay, so that makes you how old?
18.
Okay. I always think you're older. Okay, I'm gonna take your vitals real quick before we get started and then get on with our assessment.
Okay.
I don't like these.
Neither is
You better breathe.
This is covered. I used to sit in like the 98s and I had COVID, now I sit in like 96, 95s.
Really? Okay.
I guess it's the new norm.
Okay, so if you could just tell me where you're at.
Seminole Memorial.
Okay, and what are you here for?
Your assessment.
Okay, do you know what time it is?
Like 9.
Like that? Okay, you're right. Do you know your mother's name?
Virgie.
Virgie? Do you know what you did last year for Halloween?
Nothing.
Nothing?
Yeah, I don't do that.
Okay,
I think I worked.
I think you did. Okay, I would assess her nutritional status by looking at her. She is well developed. She's sitting upright. She doesn't have any physical deformities to the eyesight that I can see. Her mobility is unlimited per I walked her into this room. Her facial expressions are appropriate for the situation. She's calm. She's not agitated or confused. Her speech is clear. I can understand her. She is clearly clean and kempt. She isn't dirty. She keeps herself well. Her diet is regular. Are you on any specific diet? No. Okay. Good deal. So, I'm going to go ahead and start my assessment. I'm going to start by looking at your head and touching it, and I'm going to ask you if you feel any tenderness at all at any point, okay?
Okay.
So while I'm doing this, I would ask her if she feels any tenderness. No?
No.
I would look to see if she has anything going on in her head, which she doesn't. She has no evidence of trauma. Her hair is very clean. Okay, I'm gonna have you raise your eyebrows for me. Can you smile? Now puff out your cheeks. Good job. Okay, I'm gonna have you close your eyes. I'm gonna touch the side of your cheek, and if you can tell me where I touched.
Right here.
Okay.
Right here.
Good job. So her facial sensation is intact. So now I'm going to look in her eyes. She has no discharge, clear. Her eyes are symmetric to her face. She's not abnormal. I'm going to just have you look up real quick so I can look at the color of your sclera. Look up. And it is white, which is normal. I'm going to just have you look right here. Your pupils are at about a 5. Okay, that's fine. Do you wear any contacts or glasses? Contacts?
Yes.
Okay. I'm gonna have you look right here and I'm gonna shine my light in your eyes. Okay, good job. If you can just follow my pen, I'm gonna move it in 6 directions, 3 this way and 3 that way, okay? Okay, now it's gonna move closer to you and further if you'll just watch it with your eyes. Okay? Very good. So her pupils are round and equal. They're reactive to light. They're accommodating to each situation. She has no deformities or anything like that. By looking at her, she has no lesions or anything on her ears. They are symmetrical to her face by looking at her. Do you feel any tenderness or ringing in your ears at all at any times? Okay, so at this time I'm gonna have you close your eyes and I'm gonna do a whisper test. I'm gonna say a word and I'm gonna have you repeat it.
Right.
Okay, I'm just go on the other side.
What? Turtle.
Okay, very good. So clearly her hearing is intact. You don't wear hearing devices. Her nose is also symmetrical to her face. She doesn't have anything else going on with it. Okay, I'm gonna just have you look up real quick and I'm gonna just look inside your nose.
Oh.
She doesn't seem to have a deviated septum or anything like that. So it is intact. Did your dinner last night smell really good? What did it smell like?
It smelled like chicken tenders, like fried.
Really?
Mm-hmm.
So by asking her that, I can tell that her smell is intact. Okay, so at this time I am gonna look at your mouth and I'm gonna see that your lips are moist and pink. They're not of any strange color or anything like that. Can you give me a really big smile real quick? So I can see your gums. Her gums are within normal limits. They're not swollen or bleeding. Okay, I'm gonna have you stick your tongue out and, okay, good job. And now you're gonna stick it out and go up and down and left to right. Good job. Did your dinner taste good?
Yeah.
Okay. So by asking her that, I can tell that her taste is intact. At this time, I'm gonna assess your neck and I'm gonna feel your carotid pulses and I'm just gonna check on both sides. Now I would do this for a minute on each side. They are equal. If you'll look up, I'm going to assess your trachea. And it is midline. Can you go ahead and swallow for me? Okay. And I'm going to check her skin turgor by pinching the side of her neck. And by doing that, I'm going to assess whether she's dehydrated or not, which she isn't. Her carotid pulse is very strong. Her trachea is midline. She has no thyroid problems. Can you do this for me and go up and down? By doing that, I'm checking her full range of motion, which she has. Okay, at this time, I'm gonna put my hands on your shoulders, and I'm gonna have you shrug. Okay, very good. Okay, so now I'm gonna have you lean over that side and put your feet over so I can assess your spine and hear your lung sounds. Okay?
Okay.
So I'm gonna just go all the way down. So her spine is in the middle. She does have sort of a hunch at the top, which I will note. Okay, so I'm gonna put my hands on your back and I'm gonna have you breathe in. Okay, one more. Okay, if you can hum. Good job. So she does have symmetrical expansion, and I can hear the humming all the way down on both sides. I'm gonna go ahead and listen to your lungs while I'm back here, okay?
Okay.
Ouch. Okay, if you can breathe. Okay. Take a deep breath. And one more. And another. And one more. Okay, good job. You can lay back down now. So her lung sounds were clear on each side, which is good. So good job. So now I'm going to listen to your front lung sounds and your heart sounds.
Okay.
Ready?
Mm-hmm.
Take a deep breath. Sorry.
It's okay.
Take a deep breath. One more. Good job. One more. And one more. Good job.
Okay.
So all of her breath sounds in the front are all clear. She doesn't have crackles or wheezes or rhonchi or anything like that. Her respirations, they are regular. She's not gasping for breath or grunting. She's not using any of her accessory muscles. She doesn't have a cough. Have you had any sputum lately?
Mm-mm.
No? Okay. So now I'm going to listen to your heart. I'm going to listen to it in 5 spots, okay?
Okay.
Okay, I'm just go under. Sorry.
It's okay.
Last one. Okay. So I would listen to those for a minute at each spot, listening for her S1 and S2 sounds, which I heard in all 5 spots, her aortic, pulmonic, Erb's point, tricuspid, and mitral. Her apical heart rate I would assess for an entire minute. Her rhythm is regular. She does not have a pacemaker. Okay, so now I'm going to assess your upper extremities. So if you can just squeeze my fingers for me and pull. Good job. So by doing that, I would assess that she has full range of motion. She is strong in her her strength is equal bilaterally. I'm gonna go ahead and listen or feel for your pulses on each of your arms, okay? Okay. So both of her brachial pulses were very strong and they were equal. Her radial were a little bit thready, but still very, very much palpable. I'm gonna go ahead and assess your fingers for your cap refill. Her nails are within normal limits. She does have sensation and she does not have any edema. If you can go ahead and lean your head from left to right for me. So by doing that, I would assess that she does not have jugular vein distension. Okay, at this time I'm going to assess your abdomen. So I'm going to have you lean back. Will you want to do it?
Sure.
Okay. Oh.
Hold on.
Gotcha.
Thanks.
Okay. Have you had any tenderness in your abdomen recently? Okay. So by doing this, I would pull her shirt up and assess her abdomen, which I'm not going to do because it's on video. But
You're not gonna.
well, I'm going to put my stethoscope, but I'm not going to
Okay.
just show you. Okay. So I would assess then that she is soft and she's regular. I would assess her umbilicus and it is midline. Do you have an innie or an outie?
An innie.
So it is inverted. At this time, I would inspect her abdomen. I would see it first, and then I would listen to your bowel sounds, which I would listen to each quadrant for a minute total. Okay. So then I would palpate and make sure she doesn't have any tenderness. Do you feel anything? No? Okay. So then she's good. You can sit back up. So she does have normal active bowel sounds in each 4 quadrants. Tell me when you're good.
You should.
Okay. Do you remember when your last bowel movement was?
This morning.
So 10-1.
Mm-hmm.
Was it normal? Do you remember the characteristics of it?
It was normal. Like,
Just normal?
yeah, just normal.
Okay. Have you had any belching, vomiting, heartburn, nausea?
Mm-mm.
Okay. No cramping or constipation or anything like that?
Mm-mm.
Okay. She doesn't have an ostomy. Have you had any urinary problems recently?
Mm-mm.
No? Okay. Can you describe your last void to me?
Clear, yellow, no smell.
She doesn't have a catheter. Do you remember when your last menstrual period was?
The 1st of September.
Okay. So now I'm going to go and assess your lower extremities.
Okay.
if you can put your legs out straight, I'm gonna have you pull your toes towards you. Okay, and push. Very good. So for doing that, I would assess that she has full range of motion, and they are strong and equal bilaterally on each side. So now I'm gonna assess your pulse on each of your legs, okay?
Okay.
Now I would do this for a minute in each spot. I don't want to take your shoes off, but I'm going to take one of them off.
Okay.
Okay. So then I would assess both of them on top. I don't want to take your shoe off. Then I would check your toes to see if you have good capillary refill, which you do. I'm gonna leave your shoe off.
Okay.
Okay. So all of her pulses were strong. Capillary refill was good. She has normal nails, no clubbing or thickening or anything. She has sensation. She has no edema present. And by that, I would just see, none. Do you have any pain anywhere?
Mm-mm.
Okay. Do you have any scars or anything anywhere that I would know about?
Mm-mm.
No? While doing her assessment, I would assess her skin throughout the entire thing, which I can see that is clean, intact. There's no breaks in it. It is moist and warm to touch. She doesn't have erythema or jaundice. Her skin color is consistent with her ethnic background. She doesn't have tinting or anything in it. She does not have an IV, and she doesn't have any tubes or wounds. So that concludes our assessment. So now I'd make sure that her bed is in the lowest position as possible. I would lock it. I would ask you if you needed anything else.
Mm-mm.
No? Okay. So I'm gonna go wash my hands and I'm gonna go document.